Hello, this is Dr. Jay Hartley at the Hartley Chiropractic Scoliosis Center in St. Augustine, Florida. This is Savannah. She's going to be helping me today. And we're going to be talking about Scoliosis Awareness Month and utilizing an app on our website that helps you to screen your friends and family, and it lets you know whether it looks like they may have scoliosis. So I'm going to get a little closer to the camera. And if you go to our website, drjhartley.com, and the homepage will kind of look like this on your phone. And then you go over to the three bars and you'll click scoliosis. And then you click online screening. And it says online scoliosis screening app. You click that. And then you'll see that screen come up. You'll hit that. And then it takes you through a series of questions. And it first is a consent that you're ready to get checked. You'll take care of that. And I'm going to have Savannah turn around. So Savannah, turn and face this way for me. Okay? And so the first thing we're going to look at is shoulder levels. Is one shoulder higher than the other? In scoliosis patients, it's very common for them to have a high shoulder and a high hip on the same side, and that is most commonly the right side. So the first thing you're going to do is check the shoulder level. We're just going to put yes as we go through this. Does one shoulder blade stick out more than the other? So on a scoliosis patient, you may see some weird things going on with the shoulders, but a lot of times there's a winging of the shoulder blade. So if we were to see that, it would look something like that. We're going to click yes. Then we're going to look at the waistline. Okay. So scoliosis is very commonly discovered this time of year when people are going to the beach, and the parent will look at the child as they're walking away from them, and they'll notice some changes in the hip line. So when we look at the hips, they should be symmetrical like this, where there's a waistband effect on both sides. If we see straight on one side and then a waist on the other side, that's an indication of a lumbar scoliosis. So when we look at the waistband, you can see how it's curved on this side, straight on that side. So we're going to click yes. Then we're going to look do we see a general scoliosis pattern? So we may just see a wave in there of the spine. So if we see that, we're going to click yes. And then when the patient bends forward, go ahead and bend forward for me, Savannah. When you bend forward on a scoliosis patient, you'll typically see a right rib arch. And that's what we're seeing in the diagram. So we'll put yes. And if they have a thoracolumbar or lumbar curve, you would also see a left lumbar arch. And so if we were to see that, we would hit yes. Is there a family history of scoliosis? So is any of the siblings, the parents, the grandparents, do any of them have scoliosis? If that's yes, you click yes there. Male or female. If you're female, you're 80% of scoliosis is in females. So if you have all these postural signs and you're a female, you're more likely to have scoliosis than if you're a male, but there's plenty of males that do have scoliosis. So then when we're all done, we'll click female, hit submit. And then it gives us a rating of whether it looks like we have scoliosis. So we checked it yes on everything. So then it let us know that there's a high risk of this patient having scoliosis. So thank you very much. Get on the website, drjhartley.com. Check it out. Check out the app. And go out there and screen your friends and family. And this month is June, Scoliosis Awareness Month. If you have any specific questions, you can contact Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. This has been Dr. Jay Hartley. Go out there and make yourself a great day.